Good morning, everyone, and welcome. We're going to give it about a minute or so. I see that folks are entering into the webinar, so I'll give it a minute to get us started. Thank you. Good morning and welcome. I want to go ahead and get us started. Thank you for joining us for the Social Determinants of Educational Success Centered in Mental Health System webinar. I'm Dr. Cilia Martinez, Assistant Vice Chancellor of Student Equity and Success at the Chancellor's Office. And it is my pleasure and really appreciative that you're able to join us this morning and taking the time to join us for Mental Health Awareness Week. Before we get started, I just want to remind you that you do have access to live captioning. You just have to click on the closed caption icon. And lastly, you can engage with us by using the Q&A chat box, and we will try to answer as many questions as possible during the live session. Next slide, please. This is what our time together looks like this morning. We will start with Chancellor Oakley and his system updates. He will be followed by Vice Chancellor Rowan O'Shaughnessy, who will provide a formal introduction and provide the background for this morning's webinar. Vice Chancellor Rowan O'Shaughnessy will be followed by our two students, who I'm excited to hear from Taft College and Compton College, who will share their student experience with mental health services on their campuses. While Dr. LaTanya Parker will walk us through what it looks like really to affirm the learning environment to support student mental health with a DI lens. We are also pleased to be joined by Guadalupe Castro from Imperial Valley College and Nicole Johnson from Cuesta College, who will be able to provide us with examples on how to plan with the student-centered focus. And then lastly, I will close this out by informing you of additional professional learning opportunities that are available to you. Next slide, please. Our next system webinar, just a reminder, will be on June 1st. This will be our State of the System webinar, and most importantly, we will be able to celebrate our 2022 graduates. This will be a special webinar, so it will be an hour and a half instead of our normal 1 hour webinar. So I hope that you will join us to celebrate our students. And then also our final Mental Health Action Week webinar will take place tomorrow, May 5th from 2 to 3 p.m. And the title is Trauma-Informed Care, an Essential Tool for Colleges. And we will go ahead and place the link in the chat box for you to register. And hopefully you'll be able to join us for that as well. And now without further ado, I want to go ahead and turn it over to Chancellor Oakley.
All right, good morning, and thank you, Dr. Martinez. Good to see everyone again, even if still in boxes. And it's been nice to get back out to the campuses. Recently, I've had a chance to be on several campuses. I was just at Bakersfield College yesterday in the current community college district, so it was wonderful to see everybody there. We are focused, as always, on student success. And today's webinar focuses on one very important aspect of student success, and those are the social determinants of educational success, and specifically mental health. You all know that our nation, our state, our communities have been experiencing mental health crises, and this directly affects our students and their learning. It also affects our faculty and our staff. So this is an important webinar today to put a focus on this issue, to put a focus on our first annual Mental Health Action Week, which was adopted by the Board of Governors in January, and to bring people together to talk about how we can support our students. I want to thank all of our colleagues who are here to share their experiences from their perspective and what their colleges are doing. And most importantly, thank you to the students that are here today for sharing their stories. And I want to specifically thank the SSCCC for the work that they're doing to bring attention to this very important issue. We are in the middle of budget advocacy season. We're expecting one of the largest budgets for the California community colleges. And so it's critically important that we focus our efforts in our budget advocacy on the needs of our students. Mental health, certainly, as well as Cal Grant reform the opportunity to put more resources toward our students, invest in them, and help them succeed in our community college system and beyond. So I hope that we continue to come together and see this as a moment of urgency in our advocacy for our students. There will likely not be another budget this supportive of our system for some time to come. So now is our moment to support our students. So please join us in our advocacy. Keep telling the story of our students. Keep telling the story of how they are persevering through their struggles, but with a focus on what we can do to lower the barriers that they are coming across. And certainly mental health is one of those barriers that we can impact. So thank you all for tuning in. I also want to end by just, again, at the Chancellor's office, we continue to try to provide more support to the colleges, more support to these efforts, more support to our students. So the Chancellor's office has recently began a realignment to center ourselves, center the agency structure on the vision for success, and specifically the issues that we're talking about today. And as I close, part of that realignment is to provide more expertise, more support in the Chancellor's office. And I want to publicly welcome our newest member of the team, Executive Vice Chancellor, Dr. John Hetz, officially now part of the California Community College's Chancellor's Office team. So I didn't want to lose this moment to welcome him to the team. I know you all know him, but he is now an official member of the Chancellor's Office team. So welcome, Dr. Hetz. And with that, I will turn it over to Vice Chancellor Rowan O'Shaughnessy.
Sorry about that. Thank you, Chancellor Oakley. Good morning, everyone. Welcome to the system's first Mental Health Action Week and today's webinar. I want to thank the Board of Governors for making it a system priority official, and then also thank all the stakeholders we engaged with in the drafting process and provided tremendous support and valuable input. I hope some of you were able to join us on Monday for the Intro to Mental Health conversation, and then yesterday afternoon on self-care. Both sessions were fabulous, and I highly encourage that you listen to the recordings when they become available at the VRC. Today, you will hear from our students, faculty, and our health and mental health associations, sharing their perspectives and insights into how our system can move beyond episodic care and siloed approach to mental health and towards the student-centered support ecosystem that address a continuum of student mental health support needs. Before I turn it over to our esteemed presenters, I would like to spend a few minutes on social determinants of educational success, which is the framework that the Chancellor's Office has adapted from public health and relies on to support colleges to create a sense of unconditional belonging for our students. Student mental health is a core social determinant because we know it significantly impacts student success. Next slide. Here's really our why. Right? Mental health is the #1 need highlighted by our students, and it's not a new issue for our system. A quarter of our student population experienced a diagnosable mental illness. And that, based on the current enrollment number, we're looking at about 450,000 students. That's pre-pandemic, and that's roughly the size of the city of Long Beach. We know that the pandemic not only exacerbated mental health issues significantly, but also magnified pre-existing inequities experienced by students from marginalized communities. So what I want to emphasize is that what you don't see on this slide, which is there are many more students who experience mental health struggles, do not fully communicate, or even I'm sorry. Okay. So there are many students who experience mental health struggles, do not fully communicate or even recognize their struggles due to the stigma surrounding mental health, right? So we know these numbers understate the persistence and severity of the problem. Next slide, please. Here's the fun part. So I want to show you a short video And I apologize if some of you who have seen this several times already, but it's short.
In a small fishing village, a group of folk gathered at the river. Not long after they got there, a child came floating down the rapids calling for help. One of the group on the shore quickly dived in and pulled the child out. But minutes later, another child came, and then another. And then many more children were coming down the river. Soon, everyone was diving in and dragging children to the shore, then jumping back in to save as many as they could. In the midst of all this frenzy, one of the group was seen walking away. Her colleagues were furious. How could she leave when there were so many children to save? Then, after long hours, to everyone's relief, the flow of children stopped, and the group could finally catch their breath. At that moment, their colleague came back. They turned on her and angrily shouted, "Hey, how could you walk off when we needed everyone here to save the children?" She replied, "It occurred to me that someone ought to go upstream and find out why so many kids were falling into the river. What I found is that the old wooden bridge had several planks missing, and when some children tried to jump over the gap, they couldn't make it and fell through into the river. So I got someone to fix the bridge."
Thank you. I hope you find this video to be fairly straightforward. It's essentially calling out the importance of upstream thinking as part of the solution set in solving persistent problems and achieving long-term objectives. Our colleges and our frontline mental health practitioners have been doing the heroic work of supporting and lifting up our students every single day, right? But the help is on the way, right? So from 2021 to 2022 state budget, for the first time, our system is receiving and will be receiving ongoing funding of $30 million dedicated to student mental health. This historic investment will be tremendous in expanding and strengthening existing services. But if we do the math, use the 450,000 number that I mentioned earlier, the funding essentially translates into $67 per student annually. And those are for students with diagnosable mental illness, which is less than the cost of a typical mental health counseling session, right? So what are we looking at? I want us to go back to the video. Mental health is the #1 need serviced by our students, and it's a persistent need. Bringing more people downstream to help is absolutely necessary and vital, but insufficient, even with this new additional funding. We have to also go upstream and look at mental health promotion, prevention, early intervention, and more importantly, look at existing structure and identify the broken part of the bridge. Which are the structural barriers that could create and exacerbate student friction points that contribute to the development and worsening symptoms of mental health conditions? Next slide, please. So I want to always get us back to our collective North Star, right? Vision for success. And these goals remind us the commitment that we are serving the top 100% of the students, and we're striving to improve educational outcomes of all of our students, not just some. So our obligation is not just to provide high-touch support to a few of our students, but also to make sure that we build towards an ecosystem that truly creates a safety net and differentiated support for all of our students. Next slide, please. I want to make it clear that this ecosystem approach is not something additional. It's the Chancellor's Office contextualization of what guided pathways means to better serve and support our students. Our hypothesis is that through this ecosystem approach, we can enhance the sense of unconditional belonging for our students, so we can collectively advance vision for success. Next slide. That's why we're pushing for a paradigm shift, just from accumulation of programs and pilots that serve students and trying to maximize impact on their own, to a student-centered ecosystem approach where we align, connect, leverage, and coordinate the work. On this slide, you will see there are two kind of interlocking parts to the ecosystem. At the center of this ecosystem is shifting burdens from students to institutions, making it clear the intentionality of all of our student-centered design and redesign efforts. If we change our orientation from what we can offer students to what students need to be successful, then our focus becomes doing everything we can to advance student learning, experience, and impact. And Guided Pathways provides us with a framework to interrogate and to dismantle existing structure that harms students and developing equitable outcomes. The outer circle is the 3 core social determinants: financial stability, physical and mental well-being, and support networks. They are the 3 primary factors that the system we're seeing that most significantly impact student success, and those are the area they're within, also largely within our sphere of control and influence. And that's those are the 3 areas the Chancellor's office will be dedicating a lot of resources and attention to develop the enabling conditions to support colleges towards implementing strategies in these 3 fronts. And David, Vice Chancellor David O'Brien and I provided additional details on these social determinants elements at one of our board learning sessions last year. So I would encourage you to check out the recording. So what we're looking at here is by pushing out this ecosystem approach, where we want to mobilize the entire system around the framework. And we hope to emphasize the importance of upstream thinking and strategic planning, so we can better identify the problem, be both proactive and responsive with the support we provide to students, and then also really focusing on the intersectionality among student identities and barriers, so we can maximize resources and shift structures. So our service delivery have to be differentiated, and it can serve the many through equitable focus, structural design, and serve the few through high-touch interventions offered by our various programs to meet the diverse needs of our students. Next slide, please. This is an illustration of what we're thinking in terms of student mental health, really focusing on the continuum of need, which then has to translate into continuum services. Currently, we're very much focused in the middle section, getting better, which is on acute treatment when we see symptoms. But again, we have to recognize as a continuum, there are a lot of opportunities to address the needs across this continuum, and we have to do it differently depending on the need, right? And there's staying healthy on one end of the continuum, where a lot of the preventative care happens, routine checkups, counseling, and overall inclusive learning environment, both in the classroom and on campus. And then there's also living with it on the other end of the continuum, where students will need chronic conditions management and reasonable accommodation for students with disabilities. So again, we're seeing additional offices and programs are impacted in this collective effort. When we're looking at the continuum, also another important piece again is to make structural changes to adequately serve the need, right? So we have to really reevaluate everyone's kind of role and functions and how we can contribute. And I would like you all to keep this visual in mind as you listen to our presenters. So next, I would like to introduce to our 2 student presenters. Angelisa Garza, student from Taft College, and Sadia Escobar, student from Compton College. They will share important insights on their experience and elevate for us how we can strengthen creating unconditional belongings, which allow for fewer stressors, better healing, and stronger support. Angelisa, I'm going to turn it over to you first.
Alrighty. Hi, everybody. So my name is Angelisa Garza, and I am a student at Taft College. So I just I came on here today to share a little bit of my story, and I understand that this is a forum and I'm a panelist to help explain what we have on campus at my college, but personally I believe it's not enough, and I feel like there's not as much resources, and as there's so much diversity and adversity in different situations that certain students are in, and I believe that they need to be catered to in different ways. So I'm just going to give a little background of myself of what I do at my school, but I'm currently Associated Student Organization President, and I will fulfill another term next semester as well. So I'm a freshman this year. I'll be a sophomore. Again, I'll be president. I'm also a part of the California Community College Student Senate. And I am also on the women's soccer team. I'm also one of the captains for the women's soccer team. So as you can see, I do have a lot on my plate. And I'm telling you all of this just as a little background because I did participate also in the athletes mental health forum. And there was a lot of talk on a lack of counselors for athletes. And I understand that with funding and the certain resources that we are only given or allowed, that there aren't specific counselors for student athletes. But with that saying, we do have a counselor on campus who is right there with open doors and open arms and ready to hear us out and supporting us no matter what. And they hold their own office, which we're able to go in whenever, wherever. At our campus as well, our faculty and administration is very open to like meetings or emails or certain things like that, especially our faculty. You can go into their office hours basically. Basically whenever, I believe, yeah, there's certain days where they'll be like, oh, office hours on Mondays, Wednesdays, blah, blah, but they're very open and very kind to understanding our mentality and needs sometimes, because again, every student is different. As well as that, we just discussed that, or well, my apologies, I forgot to also mention, this spring semester, we finally have an athletic psychologist for our women's and men's soccer team. So we each have one, a male and a female for obviously the women's team, male for the men's team. And she meets with us about twice a month, and she has been meeting with us for twice a month, and it's all mentality talks and like a mental health motivational talks and teamwork and team building and just, I mean, self-leadership to get through your days and all of that. So I'm very grateful for that as well. And with that being said, there's also mentors and coaches. So again, every student is different. So I am lucky enough to have mentors and coaches that I see every day. I work for Maisha Catrona, which is my ASO advisor and also my head soccer coach, and I work for her. So I see her literally 8 hours a day out of the day. I see her more than my own mother. And again, I'm lucky to have that opportunity to see her, and she's always there when I need something. And every student is different, so not every student gets that opportunity, and I am extremely grateful. But that is just my little insight on Taft College. I'm extremely grateful for all of the counselors that we have wide open, and again, my mentors and coaches. But I would like to see some change in maybe some specific athlete mentors or counselors specifically for that. But yeah, thank you so much.
Thank you, Angelisa. I would like to turn it over to Sadia.
Yes, hi, good morning, everyone. My name is Sadia Escobar, and I am actually a Compton College student. I am a non-traditional student, recently started this journey in 2019. I'm also a single parent, and I also represent EOP and care at state level with SCCC. And it's been an honor, to be able to be, as Angelisa stated, part of this panel. We've met prior. I was also an athlete. Volleyball athlete back in fall of 2021. And my journey here, obviously, like my peers stated, every student has different needs. Perhaps mine is, I'm a single parent. I already have this, I see it as a positive thing, because I already know how to carry this role. But obviously with this role, there's always moments where, when you're running a home, when you have a child to take care of, when you have, your priorities at school, but you also have to be a parent, and keep your life in a well balance, with that being obviously my role back here to, coming back and starting my AA and seeing what I can do, to earn the education that I've always wanted. It's very uncertain when you do come across mental stability, mental awareness, especially during the pandemic, as we've seen and it was stated. During the pandemic, it was a hard time. I was very fortunate to have been in college for about a year. I think I've seen a lot of the programs that were available to me on campus. At the time, these were through Zoom meetings, and I made myself available, like I wanted to be part of those workshops. I wanted to reach out when I felt low, when I was uncertain. I was very fortunate to, if anything, I think education kept me focused. Education kept me where I wanted to be. Although here at home with the pandemic and the uncertainty of, at one point, not having the right income, like figuring out programs that were going to be, at the time being unemployed, and working and going to school full time. It seemed like a hard thing, but once I found a balance with it, and education provided me that, that I think that fire that it just thrived in me, that what kept me together was my goal. Like I always thought, like, if what I'm doing now is gonna it makes me happy, and that's why when our campus did open up to athletes, I decided to pick up on a whole new sport. Never in my life have I ever played a sport. I wasn't a professional volleyball. I became a college volleyball player overnight. I'm very, very fortunate to have a very good team with EOPS and CARE because I am a recipient. Counselors, the right support on campus. We do have St. John's Medical that has a weekly psychologist that comes in. We have opened workshops, that we can attend. Even our counselors have support groups. We talk about our past, that it doesn't identify our now, what we can do now to be more productive, and how personally, me as a single parent, how I don't want my daughter ever thinking, that there is a stigma behind mental awareness, because at their age, my daughter's only 7 years old. It's already known, we see that they are also affected by this. So to see that the right support has been given to me here at my college, and to see that it's very out there, it's no longer a stigma, and obviously the financial grants that have been given to us, that are available to us, that was such a relief, because like I said, at a point I had uncertainty over, what's going to happen, because I mean, besides me being a parent, besides me being a student, I also need to pay, there's also things that I need to handle at home, like obviously I don't want to be homeless, I have to do what I have to do. The options available to us to work on campus, work studies. I started off as a work studies too. I worked at the call center, and it's just been a beautiful feeling to know that if I overcame those obstacles, and I'm thankful for that, because I had the right support, or I seeked it, and it's beautiful to give back, I'll be graduating this June, and to be able to talk to new students, or see students that need help, because we do have those that come in and are like, how do you start this? How do, I make sure to always like make them know that mental support is there, like that it's no longer a stigma, like we're here for you. We want you to thrive, because we know that with positive thinking, with that, we know that we can all be successful. Thank you guys for your time.
Thank you both so much for sharing your story and for your leadership and the accomplishment. So for those of you who don't know, Angelisa came to our prep meeting a little bit late because she had a soccer practice this morning. So that just really, shows her dedication to really, I think, spreading the message. And Sadia, thank you so much for, after you graduate, we'll continue to, normalize all of our needs, right, to take care of our own mental health and to destigmatize that around that, right? We go to doctors when we have a toothache, right? Why are we afraid to say, okay, I'm not feeling well? So that is a conversation we also need to continue to have at a system level. So, and then also all of you are talking about the importance of ecosystem, really tying in different programs to support you, and thank you for that. So next, I would like to turn it over to Dr. LaTanya Parker, Academic Senate for the California Community Colleges, and she will be sharing her insight on kind of the importance of ensuring a DEIA affirming learning environment, right, in supporting student mental health.
Thank you for that warm invitation and so glad to be a part of this discussion. Next slide, please. Because every mind matters, my brief talk today will be about racial microaggressions in the classroom and its effect on students of color mental health. Next slide. Borrowing from the work of Daryl Wing Sue, microaggressions are the everyday verbal, nonverbal, and environmental slights, snubs, or insults, whether intentional or unintentional, which communicate hostile, derogatory, or negative messages targeted to targeted persons based solely upon their marginalized group membership. Whereas macroaggressions is defined as an act of racism towards everyone of the race. Next slide, please. Numerous research has addressed the impact of experienced racial migrations on the psychological health and well-being among college students. Today, I'll be borrowing from the work of Farber and colleagues around 3 forms of racial microaggressions, microassaults, micro-insults, and micro-invalidations. Next slide, please. Microassaults are behaviors aimed at inciting harm. These are conscious, deliberate, and explicit racist attacks, both verbal and nonverbal, and are meant to denigrate or hurt the victim. This includes calling students names, using racial slurs in dyad or group dynamics, avoiding or discouraging interracial interactions, negative displaying of images. This includes images identified in selected course material as well. Next slide, please. Micro insults include statements or actions that demonstrate cultural ignorance and unawareness. While often unconscious and much more subtle, a micro insult demeans and belittles the victim through racial slights or comments that seem innocuous, but are insulting to a person of color. So perhaps a student wearing a backpack, evidently going to class, may be mistaken by someone who is simply working in the campus environment instead of a student who is learning and growing. Next slide, please. Micro-invalidations are comments and behaviors which can exclude and invalidate people's thoughts, feelings, or experiences in life. For instance, an instructor asking an Asian American student where they are really from, implying that they are not from the United States and are therefore a foreigner or someone who does not belong in the learning environment. Instructors must possess the capability to facilitate difficult race dialogue in the classroom setting so that these instances do not take place, and they must recognize racial microaggressions as they occur. Next slide, please. In the research conducted by Daniel Solorzano and colleagues, which looked at critical race theory, racial microaggressions, and campus racial climate, the experience of African-American students, they found racial microaggressions within academic spaces have negative impacts on African-American students. And I just wanted to bring the student voice into this space around feeling invisible as a result of experiencing racial microaggressions. So I bring a quote which states, "I think that when the professors see that there's fewer of you, they are less likely to address your concerns." Next slide, please. The statement before and many alike demonstrate racial microaggressions and psychological health outcomes among college students. Here are listing a few additional consequences for students: the recurrent use of alcohol and other drugs, problematic alcohol use and school-related consequences, anxiety, depressive symptoms, psychological distress, and suicidal ideation. Next slide, please. I am encouraging all listening ears in your sphere of influence to bring about transformational change at your local institutions in terms of minimizing racial microaggressions in terms of targeted promotion of health and wellness, the creation or updating policies that target the mental health of minority groups, trainings to cultivate awareness of racial microaggressions on both the individual as well as the institutional level, and absolutely creating or continuing a culture of positive collegial racial climate, being inclusive with all stakeholders, students, faculty, administrators, and staff of color. Our curriculum developed and designed, which reflects the historical and contemporary experiences of people of color, and reinforcing through the college mission and institutional commitment to all stakeholders, and also a continued advancement of authentic inclusion of diverse voices in governance and practice. Next slide, please. And then I'm leaving you with some of our hidden jewels within the ASCCC website. One is a rostrum article designed in 2012 around the campus climate engagement for lesbian, gay, bisexual, and transgender community. And just want to highlight from that assessment, classroom experiences can have a powerful impact, positive or negative, on how students engage with their learning environments. So that's one rostrum article among many. Next slide, please. And just recently in our plenary for 2022, we voted on a resolution to increase and request funding for mental health resources, services, and professional learning. Next slide, please. We also have on our website an ASCCC Cultural Humility Toolkit, a tool for local academic senates and colleges to use in beginning action on developing a cultural humility plan, or the tool includes links to resources to use in development of a local plan, and is also utilized for self-reflection on an individual level, and the links are embedded in the PowerPoint, or you can go to asccc.org. Next slide, please. Just want to thank you for your continuous support around student mental health and wellness. Thank you for your time.
Thank you so much for your insight, Dr. Parker, and drawing really the explicit connection between the DEIA work and student mental health. And we know from data that race and ethnicity is our biggest equity gap system-wide. So when we create a DEIA affirming learning environment that benefits minoritized students, it benefits everyone. So I just want to make it clear that is the why that we're doing this work. Last but not least, I would like to turn the mic over to Lupita Castro, the president of the CCC Mental Health and Wellness Association and director of Student Health Services at Imperial Valley College, and Nicole Johnson, president of Health Services Association and director of Student Health Services at Cuesta College. And they are the partners that the Chancellor's Office is working with to really develop the infrastructure to implement this core social determinant, right? And remember the video, they're saving children downstream every day, and I'm sure they're exhausted, especially this week with additional ask for them. But so I really appreciate their time here to be with us. Mental health impacts everyone, it impacts student success. So it has to be an institutional priority. They will share with us how do we recognize and leverage the intersectionality of students and partner across different organizations within our organizations, and then also partnership externally, together build towards an ecosystem to support our students. Take it away, ladies.
Thank you, Vice Chancellor. I'm Nicole Johnson. And, I think one really practical way to put this intersectionality into practice is to ask, are the health needs of your students that face these overlapping and intersecting forms of stress being met? Are your programs aligned and addressing health holistically? Particularly looking at health data in terms of the intersections of race, ethnicity, and gender. But this also looks like community collaborations where you learn about the problems and conditions that your students face, because this is where the students live and many times where they grow up or grew up. So it involves having this multidisciplinary approach, which we're seeing here today, right? The ecosystem and addressing mental health, doesn't just happen in the therapist's office or within health services. We have to be embedding into all of our programs and finding our champions and allies on campus. It's the work of everyone 365 days a year. And leadership, you are critical. We saw great examples on Monday of this, but your support will challenge the campus where it needs. So establish wellness as an institutional value, design policy and also action, and seek out unique opportunities for funding and programming. Which really leads me to the importance of finding those everyday practices, which we're going to talk about, Lupita and I today, that influence the campus climate and promote wellness. These are often the simplest changes we can make. You can't have practices without institutional support, but we also can't make the mistake of designing policy without your students or while neglecting the practices of an everyday healthy campus. Not all students who need support walk through health services, but they are in the classroom, they're sitting in club meetings, and they're on athletic teams. And this is where you will connect groups of students who may be disproportionately impacted by the social determinants of health. So with this, I'm going to pass it over to Lupita to share with us some about changing the campus culture.
Yes, good morning, everyone. I'm very grateful for having this opportunity to start this conversation and from the Chancellor's office moving forward with this Mental Health Action Week. And I would like to add more to what Nicole just mentioned, because we want to live today with ideas on how to promote this healthy campus climate. So there's 3 components we've been kind of like brainstorming and discussing all these past days. And one of them is helping our campuses to be more culturally responsive to our students, because every campus is different with different needs. And that's where it comes to align the practices we do in the different roles. Again, you don't have to be a clinician, you don't have to be a nurse to respond to our students' needs, but you need for sure to understand what is the campus culture, race, and ethnicity, and also how your campus is running on behalf of the mission, the strategic plan, and what are those practices that they are planning for this school year or next school year, and creating safe spaces, because sometimes the lack of knowledge or experience or training make us respond to students, out of human reaction, maybe let's say with facial gestures or some body cues that they are not welcoming students. And again, you don't have to be the practitioner, but you can apply, that trauma-informed model or approach. And I know tomorrow we're going to have more information about that, but be understanding that students come with a backpack. That's the way I describe the students. You carry so many difficulties, stressors, trauma, and we as professionals, we are the perfect person to support you in this journey as a student, or support each other as collaborators, on campus or in the community, to create those safe spaces instead of doing unsafe spaces for students. And that's unintentionally, but sometimes we go through that. And obviously the hiring of professionals, that they connect with your student population, that they understand the culture and the campus climate, applying our equity, diversity, and inclusion approach. So student-centered pieces that come very important to the healthy campus climate is listening to the student's voice. And this is a perfect scenario today. So thank you to our students representing today, but involving them in hands-on activities on campus. Those wellness fairs, mental health awareness fair, suicide prevention events that at least I know we do at Imperial Valley College. I tend to work in collaboration with ASG, with Active Minds, with other club members, because I want them to see involved in what they actually need. And most of the times, students have better ideas than probably us, because they are new generations and they really make us think with new lens, right? And another important thing about the student-centered approach is that we can create different subcommittees or teams. Like we do have an equity think tank team on campus, where all the different experts from the different programs like EOPS, DSPS, student health, equity, we get together and decide or discuss the ideas for implementing new student resources on campus. So that's kind of applying the equity framework too, because we want to make sure that we cover, at the Student Health Center, the health and wellness from the different angles coming from the different allies on campus. And I'll take it back to you, Nicole.
Great. I love this student-centered approach. And, another example, if your college doesn't already have a student health advisory board, and we have toolkits through HSA CCC to take action and create an advisory board on your campus. Mental health student ambassadors are another great example. And, this program exists already through the Chancellor's office, where we can bring ambassadors that are trained on CalFresh, on mental health resources, crisis support to our campuses, because they're in the classroom, they're in the clubs, they're on the athletic teams, and they will help spread the word for you. So those are two, easy, simple tools to bring to your campus. And we are going to share at the end some resources where you can continue to find additional tools like this through the HSA CCC, through CCC Health and Wellness. But yes, the student-centered approach is so important. Also, those campus allies, so faculty champions. I've heard from colleagues who have implemented Wellness Central, which is a free vetted health resource center HSA CCC developed, and you can embed those in Canvas. They have found faculty to include those in their syllabus, but that's what we're talking about changing the campus, right? And making everyone involved in this work. It can be town halls, another really great example we heard of this week, to listen to the student voice and what the student needs are. Another tool that I'd like to point out, especially for faculty, is if you haven't developed yet, like a crisis toolkit. Some campuses, this is called the Red Folder, and you can find these tools as well on the websites, but some type of crisis intervention toolkit so that faculty and staff can look at the key things and how to refer a student who maybe does need that elevated level of care. We've actually begun doing that at Cuesta. We incorporate this into new employee orientation. So every new employee coming through is hearing about how they can refer a student and what the resources are that are available to them.
Yes, thank you for sharing that, Nicole. And I want to add to, increasing access. We have been talking about this 30 million funding and how it's been amazing. And honestly, I know all of us are so grateful about this new funding, but as we heard, it's not going to be covered for all the needs we see. So one of the things that we have implemented at Imperial Valley College is we created an MOU with the Imperial County Behavioral Health Services, so that way we ensure that students are covered for those long-term treatment or medication or anything that they may need besides from what we offer on campus. Also, we started this semester what it's called Wellness Wednesdays, that we are taking a research table across the different offices, programs on campus, where students can interact with the Student Health Center reps, and they can also have the opportunity to answer to the PHQ-9 questionnaire, so we can detect early signs of depression and prevention, before it escalates. And that's for free. You can find it for free on Google, on a website, and you can implement that. So we've been doing that. So we want to do more proactive and early intervention, and also wellness support groups where we can use 1 hour of a counselor to talk about 10 different students about the same topic at once, instead of using 1 hour just to have one counselor talking to one student. And we also, in collaboration with the county, we get training for free, like the mental health first aid, and also Safe Tag for suicide prevention. And also through another contractor, we have a campus wellness magazine that they paid for us, so we don't have to use those fundings for those extra resources. And we also get invited to a radio show locally that we talk about mental health issues, and we can post the recording audio for access to our students. So those other extra ideas that, sometimes that cost, but very minimum, or you can get them donated from another allies in the community.
Oh, that's great. The training piece is so important. We've really embedded both QPR and mental health first aid into our flex activities every year. So for those of you who may be unfamiliar, QPR is about a 1-hour training that will train your staff on the key ways to intervene with the student who may be having suicidal thoughts or ideations. And again, this can be implemented in an hour in a staff meeting. So, you know, you can train your trainers on campus, you can collaborate with the county to offer this training, as well as mental health first aid. But embedding those into your flex activities and finding flex activities also for our staff and employees that just promote health and wellness. Because if we're not doing this for ourselves, how can we expect our students to, right? So making it a campus climate of health and wellness.
Yeah, so I guess the main point that we want to really come up to all this conversation today is that students really are very important, very essential in making all these changes, because they are the ones who will give us the data we need to assess our programs. And that's what we are going through right now with other colleges, like 16 other colleges, about implementing the Healthy Mind Study Survey, because we want to get more data, more real and updated data that what is going on right now with our students. What are the needs after this pandemic? And based on those responses, we want to implement other changes in the next school year, and obviously using this new funding. So students are very critical. Our campus and outside allies are so important as well. So I guess this is the main point of our student-centered conversation today. Something else, Nicole, that you want to share?
No, we'll open it up or move on for questions and resources. Thank you.
Thank you.
Thank you both. And for the audience today, Lupita and Nicole also have these resources on slides. So we will distribute that after this webinar. So don't worry. And then also just approach, you know, they are great resources. Both associations are great resources. And also, you know, there are a lot of experts on your respective campuses. Lean on them. They can provide really a lot of input on how to really contribute to this campus environment of health and wellness, right? And what I'm also hearing is, again, like when we're designing something for the students, we have to really listen to the students, right? We have to center what we do with the student experience. Like student needs to have a voice and choice in these decision making, and they get to validate our design, right? And then and then how do we really lean in, you know, with the data to really engage in the continuous improvement process, right? This is enormous work, and I also want to make it really clear: this is not our work only, right? We know there are social services out there, there are mental health organizations out there, they're providing a lot of expertise in this, right? So it's also up to us to really make those connections, but also be very explicit and understand what they cannot do for our students. Then we realize then what we must do and dedicate our resources towards these things, right? So we have to really think about the continuum. At first, think less about the structure, and then think about what we will need to do to drive our strategies, and then think about all the impacted offices and programs and initiatives we have, which really, I think the presenters today have surfaced for us is really everybody, right? And then also really, frankly, how do we start with ourselves? How do we take care of ourselves so we can then better support our students across the board? So it's really a rich conversation, but this is just the beginning. Just like this is a mental health action week, that doesn't mean we only talk about mental health once a week. 1 week a year, right? This is ongoing work. This is 356 days a year work. So how do we continue to let us know how we at the Chancellor's office can continue to kind of create those enabling conditions to support your work? This is a core social determinant, so you will see more to come in this area. So I'm gonna wrap up our portion of this discussion. I want to turn it over to Dr. Martinez.
Thank you to our presenters. Thank you to our students for lending their voice today and highlighting, right, your student experience. I think that's always very important. If we can go to the last slide as we conclude our webinar, I just want to remind you, and I think Dr. Parker did a good job of highlighting, obviously, the campus climate matters, right? What are the students experiencing on our campus so that they can thrive? So I want to highlight the 2 DI professional development opportunities, and that's 2 modules in the Vision Resource Center. The first one addresses cultural competency and the second one implicit bias. The first one is I don't see color, I just see people becoming culturally competent. And this learning module really examines how our US educational system perpetuates, right, the inequities, but it also introduces a framework that you can leverage to promote cultural competence on your campus. So I really encourage you to take these, and these are self-paced, so you can start and come back. And then the next one is playing behind the screen, the implicit bias in our colleges. So this is a learning module that introduces the implicit bias, but also offers you strategies to address and improve the educational outcomes for students and the experiences for everyone on our campus. So as we said, as we're taking care of our students, we also need to be taking care of ourselves. So I really encourage you to take these two modules in the Vision Resource Center. And again, we will send a follow-up email that will have a link to the Vision Resources on how to log in and have access to today's webinar and the slides. So again, thank you for joining us, and we hope to see you again next month as we celebrate our students and their accomplishments. Thank you and have a good day.